the eye to respond. So this is an increase in accommodation. And during this period, so no change occur. So this we call this a latency. Okay, so it will take about sometimes before your eye can respond to a near stimulus. And then you can see that when you are looking at the near objects, so the eye will take a bit of time to reach to like a plateau response. Okay, so for this we call the reaction time. Of course, the reaction time, the shorter the better. Okay, of course you don't want to like spend a lot of times to get to the plateau. And this is, if it's shorter, that means you can change your focus very, very rapidly. And you will also expect to have some fluctuation of the accommodation. So you can look at the figure here at the bottom. So the objects is maintained at the same position. Okay, but then you can see that the accommodation does not. The accommodations will have an increase and then decrease and increase and decrease alternatively. Okay, this actually serves as a negative feedback system. For example, if I look at here, okay, if you change it from a distant to a near object, so if I look at the eye response, so a small amounts of accommodation, and then for this is the latency, so no response, and then it'll start to increase quickly to here, and then from there, okay, we'll start to increase the accommodation. But then you realize that if you keep increasing the amounts of accommodation, so the image get not even better. It would be the other way around, because when you keep increasing the accommodation, so the image will be forming in front of the retina. So and that's why they have to relax accommodation. And when they relax, they get a better vision. And the further relax, again, when you further relax, the image quality reduce. I mean, you at that point you won't get a very clear image, and then you have to increase it again. So it's just a negative feedback in order to keep your accommodation more or less stable during the near vision. Based on experimental data, we find that for the latency, if you change the objects from distant to near, it will take about 0.3 seconds, so 300 milliseconds, okay, to respond. And this is when you change from near to distant. So this is a relaxation of accommodation. So the latency takes a little bit longer, maybe I would say maybe another 50% longer compared with the distant to near. For the reaction time, again, is similar, the trend. So distant to near, shorter time, okay. So that means the eyes is capable of accommodate very quickly. The relaxation of accommodations take a longer time, okay, from near to distance. Fluctuation is about 0.2 to 0.3 diopters, okay, and this serves as a feedback system in order to maintain the good quality, the qualities of the retinal image. Okay, so as I said before, here we want to talk about the characteristics between the accommodation stimulus and accommodation response. Okay, when you put objects at distance, presumably at infinity, so the stimulus to accommodation should presumably be zero. Okay, if you put objects at infinity, so you should have no accommodation, and therefore this should be zero. And in experimental condition, we find that the accommodation should be zero for distant objects. But in the experimental condition, we find that this is not true. So even when you present an object at distance, you still have a little bit of accommodation. So meaning that the accommodation is not totally relaxed at distance, okay, based on the human data. And even without the accommodation stimulus, we still have a small amounts of accommodation. So this can be illustrated using this diagram. So this diagram illustrates the relationship between the accommodation stimulus and accommodation response. One of the very important thing for plotting this graph is that we should assume that all patients should be fully corrected. If they are not fully corrected, so this diagram will not be valid, because remember when we talk about the uncorrected hyperopia or uncorrected myopia, for uncorrected myopia, so you may accommodate less. For uncorrected hyperopia, you may use up the accommodation faster. So that's why, I mean, the uncorrections of refractive error will definitely contaminate your result, will produce artifact. And that's why for all the information we talk about here, we should assume that all the patients are fully corrected. So you can see that this is the accommodation response as a function of accommodation stimulus. This is when you're looking at distant objects, presumably at infinity. This is when you increase your accommodation, meaning that you're looking at near objects. Ideally, it should be like 1-to-1. Whenever you increase the accommodation stimulus by 1, you should have a corresponding 1 diopters of accommodation response. If you have a stimulus at 50 centimeter, meaning that you have a stimulus that's 2 diopter, accommodation response should also be 2. If you put objects at 10 centimeter, meaning that you have a stimulus of 10 diopter, okay, so your response should also be 10. So we should have like a 1-to-1 ratio, and then this line should also be a straight line with an angle of 45 degrees. But in reality, so we find the accommodation response is not overlapping with the accommodation stimulus. And the one of the common things that we see is that we have this like a sigmoid curve. Okay, so having like an S shape. Okay, at this end, meaning that the patient is looking at distant objects. Usually the patients will have a little bit of accommodation, even this is not required. Okay, when you're looking at distant objects, so the patients will accommodate a little bit, as mentioned in the previous slide. Okay, and this is called the accommodation lead. Okay, and on the other side is the opposite. So when you're looking at distant near objects, presumably should be like a 1-to-1, but now you can look at here. So the accommodation response is actually less than what is required for that particular stimulus. Okay, so on this side, so we have the accommodation lag. So this is accommodation leak. Okay, so that means you over accommodate. This is accommodation lag. That means you have under accommodation. Okay, so your accommodation is not sufficient for near objects, but it's a little bit over when you're looking at distant objects, and that's why we have this sigmoid curve for most patients. And this is the intersection between the ideal situation and also the experimental condition. Okay, and people find that the intersections between these two lines is usually at around 1 to 1.5 diopters of accommodation. Okay, so at this position, so you can see that so the stimulus and the response are in 1-to-1 ratio. Okay. Okay, in theory, so the response and stimulus should always be equal, regardless of whether it is at distant or near, and the ratio should be 1-to-1, and also with a slope of about 45 degrees. Okay, but in reality, in real situation, we find that this deviate. So this expectation cannot be fulfilled. Instead, we have a S-shaped curve. Okay, at distance, we have over accommodation or accommodation lead. Okay, causing the eye to be more myopic, because when you accommodate more than expand, so that means the total power of the eye exceed your distant prescription, and making the eye more myopic at distance. But for near, we have under accommodation. So the accommodation is not sufficient for that particular distance. We call this accommodation lag, making the eye more hyperopic or less myopic. And on average, the accommodation lead is about 0.5 to 0.6 diopter, depending on different individual. And for accommodation lag, the accommodation lag is usually in the range of 0.25, a quarter, to about 0.5 diopter in most patients. And in some subjects, we also find that the accommodation lag may be more along a certain meridian. For example, in this case, based on one study, so the accommodation lag seems to be higher along the horizontal meridian. You might expect if you have more lag along one meridian over the other principal meridian, then this will cause a change in the astigmatism at near as compared to distant. Okay, when you change your focus from distant to near or from near to distant, then it will induce a change in the astigmatisms if you have a more lag along one meridian over the other. At some intermediate distance, the response curve will pass through the equality line. Okay, so this is the points of intersection, and this crossover point is considered to be indicating the level of accommodation at the resting state. Okay, so and for this reason, sometimes we also call this is the resting state of accommodation. And this crossover point, this intersection, in most subjects is around 1 to 1.5 diopter in young adults. Okay, because in young adults they can still have sufficient amount of accommodation, so it's about 1 to 1.5 diopters of accommodation. Okay, so maybe I will take like a 5 minutes break, and if you have any questions, you can ask me during the break, and we can start again at maybe like a 1:35. Okay, so let's take a 5 minutes break.